across the 30, pulls his way to the 27.
He took. Yes, we can.
Welcome to Clarke County, Georgia. It's surrounded by Jackson, Faribault County, Orchardville, and Madison. There's a 2-lane road leading up to Clarke County with fields of beautiful green grass and the whitest pear white trees. There's even cute little family homes with a kiss of southern Georgia and grass in between these homes. There was even a cute little patch of goats of all ages down a smaller road. A little further into Clarke County, you can see tractors, which are very popular. Here's a little bit more of the scenery as you enter the midst of Clarke County. These homes are very beautiful. And now you're coming into a 4-lane road, and when you take exit 1, you can see a Kroger, Trader Joe's, Jittery Joe's, Barbaritos, Chick-fil-A, and more. So off of College Station is now that you will arrive at the University of Georgia. As you approach the Athens areas, there are 10 places where you can seek medical care: St. Mary's, Piedmont, the University Health Center, Bulldog Urgent Care, Brady Urgent Care, and more. Just about 5 minutes before you reach the heart of downtown Athens, you see stoplights with crosswalks, but not that many people are out there walking because it is a busy street. In a span of 2 minutes, there's McDonald's, Checkers, Chipotle, Taco Bell, Zaxby's, and more. Just right at the fast food central, there's a Kroger with a pharmacy, Fresh Market, Starbucks, Chick-fil-A, and more fast food restaurants. Near the supermarket, there's Athens Piedmont Regional Hospital, and you can't forget about the famous Varsity, known for their cheese fries and hot dogs, which is in walking distance from Greek Grow and Golden Pantry. There are some walking areas, but around the university is best for walking, and that's where the most people are out and about. The roads are nicely paved, there is no trash. In downtown Athens, there are traffic lights near UGA that everyone abides to, and there are crosswalks, sidewalks for pedestrians. The heart of downtown is a mix with old and new Athens, a legendary music scene with live venues, for the intimate, acoustic to indie to dance halls. Athens is the ultimate college town where campus and downtown meet. Dine street side or rooftop. Bishop Park holds a weekly Saturday farmers market where you can pick up fresh fruits and vegetables and more. You can always find a diverse population of people in Athens, and that is why we chose it for community assessment. Demographics of Clarke County. Clarke County consists of predominantly white, making up 64.8%, followed by white alone non-Hispanic or Latinos, Black, African American, non-Hispanic, and Hispanic or Latino, according to July 1st, 2019. In Georgia, Clarke County is ranked 5th out of 159 counties in the income below poverty line. The median household income is $38,623, and persons in poverty is 25.7%. Food insecurity is becoming increasingly prevalent in Athens-Clarke County. According to Grady, food insecurity rate was 22% in 2016. Looking at the secondary data, this accounts for 21.6% of the population in Clarke County being food insecure. It is said that adults are less likely to have received a high school education than the average adult in America, but it's more likely to have a 4-year college education in Clarke. The average life expectancy age is 76 years old, and there are cases of sexually transmitted diseases. Here, we look at the maternal and infant mortality rate. According to CDC, Black women in Georgia are 3 times more likely than white women to die from pregnancy-related complications. When looking at the infant mortality rates, there are 556 infant deaths per 100,000 live births and 66 deaths per 100,000 in the population. And lastly, when looking at the chronic disease rates, 11% of the population in Clarke County has been diagnosed with diabetes. 24.1% are experiencing high blood pressure. 28.1% are classified as obese. Out of all the towns in Clarke County, we chose Athens, Georgia for the community assessment. The median age in Athens is 28 years old. In Athens, there are 12 elementary schools, 5 middle schools, 4 high schools, and 5 universities. It's also the home of the University of Georgia. You can find various cultures, diversity, art, music. There are also 5 food banks located in Athens, Georgia. Since the median age is 28 years old in Athens, and there's a high influx of elementary schools, middle schools, high schools, and university, we chose the target populations of adolescents through young adults, usually ranging from 10 through 24 years old. To dive further into Athens, Georgia, we had a couple of questions that arose after reviewing the secondary data. 1. What is the main public health nutrition concern? 2. Why does Athens have available food but the population is food insecure? 3. If the population in Athens is food insecure, how come 21.8% are classified as obese? 4. Half the population of Athens is female. How does food insecurity impact the population? Are there education workshops? 5. Who are the key informants of Athens? 6. What matters to the town of Athens? 7. How do we engage with our target population? 8. What are the resources already available? And 9. Are there programs already available out there targeting food insecurity in Athens? To help us out with our 9 questions, we chose 7 key informants of Athens, Georgia, just to learn a little bit more about the town. Then we used that information and collected primary data. Let's meet our key informants and learn why we chose them. Dr. Kindler is a nutritionist and bone biologist studying the roles of diet and chronic disease in peak bone mass. His research focuses on identifying determinants of peak bone mass, notably with respect to diet and chronic diseases. His lab uses several bone imaging methodologies for clinical and translational research studies. Let's meet Dr. Kindler.
I am an assistant professor in the Department of Food and Nutrition at the University of Georgia. Just started in August 2021, so almost a year ago now. And I came after completing postdoctoral training in translational research and gastroenterology and nutrition at the Children's Hospital of Philadelphia. PhD in foods and nutrition actually here at the University of Georgia. Did my dissertation focusing on the role of insulin resistance and different endocrine factors involved in bone health in kids. So did that from 2012 to 2017 after doing my my undergraduate research and education at Penn State.
Beth is one of the most friendliest registered dietitians. You can find her up in the health promotion department at the University of Georgia. She's a nutrition education coordinator and oversees the peer nutrition educators and also is a certified nutrition support clinician. Let's meet Beth.
My name is Beth. I'm a registered dietitian nutritionist, and I went to UGA for my undergraduate and graduate degrees, and then I've been a dietitian for this year is my 10th year of having an RDN credential. And I spent 7 years working in acute care and nutrition support. And then I've spent the last 2.5 years working here at the health center. I've lived in Athens since 2001, so hitting 20 years.
Camilla works up at the Student Affairs and the Health Promotion Department. She is the Healthy Relationship and Sexual Health Coordinator. Let's meet Camilla.
My name's Camilla Herndon. I use she, her pronouns, and I am the Sexual Health and Healthy Relationships Coordinator at the University Health Center. So I work with students delivering group programming and individual programming on the topics of sexual health and healthy relationships, but we also cover a bunch of other wellness topics relating to stress management, sleep management, and we also do like alcohol and other substance use and consent and sexual assault prevention. My background is in public health, so I went to UGA and got my bachelor's in health promotion and then went straight through and got my master's in public health.
Emily Jones is a registered dietitian at the Georgia Department of Public Health. She works up at the East Athens-Clarke Clinic as a clinical manager. Let's meet Emily.
I am a registered dietitian and clinic manager for the East Athens-Clarke office. We are a supplemental food program for women, infants, and children. The program was designed to help improve nutrition for low-income families, for pregnant moms or prenatal moms to the postpartum period, as well as their children age birth to age 5. We do various referrals, hematological testing, anthropometric testing, nutrition education, and also breastfeeding education and support. And our clinic before the pandemic typically saw about 15 to 20 people a day per.
Paula Feimer is a registered dietitian nutritionist. She's also the director of the School Nutrition of Clarke County School District. Let's meet Mrs. Farmer.
My name is Paula Farmer, and I am currently the School Nutrition Director for Clarke County School District. I've been in this position for 20 years now, and I am a registered dietitian. I've been a registered dietitian for 30 years. I spent the first 10 years of my career as a clinical dietitian at Emory University Hospital, and I love that. And interestingly enough, someone from the Georgia Department of Education School Nutrition Division came to speak to the dietetic interns. And I don't know how I was a part of that. Nonetheless, it sparked an interest. So I hung up my lab coat and put on a hairnet, and I became a lunch lady, and I haven't looked back.
And last but not least, Courtney Keith and Caitlin Laudermilk are both UGA students in the Department of Food and Nutrition. Courtney is a senior dietetics major, an RA assistant, and a peer nutrition educator. Caitlin is a senior in nutritional sciences at the Department of Foods and Nutrition and is pre-PA. What is the main public health concern in Athens, Georgia?
Throughout Athens-Clarke County will be food insecurity.
With respect to nutritional intake.
That 1 in every 5 children suffers from food insecurity.
A lot of specific nutrient deficiencies that I know are pretty common, especially for females.
Why does Athens have available food, but the population is food insecure?
I think the disconnect potentially is how to connect those resources to the students. From my experience in feeding children during the summer, because you think about it, we have 11 to 14,000 students that depend on school lunch during the academic year. So what happens to those children during the summers?
If the population in Athens is food insecure, how come 21.8% are classified as obese?
Unfortunately, a lot of now is childhood obesity. So my research program, unfortunately, we're able to now study type 2 diabetes during childhood and adolescence. So part of my research program is focused on type 2 diabetes and its effects on cardiovascular disease and fracture risk. So these are really important. We look at the trends 1 in 4 about U.S. children and adolescents are obese. So in Georgia at large, what we tend to see is that overweight and obesity rates tend to be higher really in the southeast part of the country. To the micro location of here in Athens-Clarke County is that these kids we do see an overrepresentation, overweight and obesity, potentially in racial and ethnic minorities, Hispanic youth, and individuals of African-American ancestry. So they're likely sitting a little bit higher on the growth chart, the BMI growth chart, than their healthy weight counterparts.
About half the population of Athens is female. How does food insecurity impact? Are there education workshops?
I also hear a lot of my residents talk about this as well, but iron deficiency, calcium deficiency, not having the particular foods that can provide those nutrients. I know accessibility is really important too, especially for girls living on campus and just having places that they can find foods that are rich in iron and calcium. And it's that class, but one of the things that I learned was like with specific nutrients and their role.
For WIC patients, yes, because we are required to talk about prenatal vitamins. We're required to talk about folate, and why do we take the prenatal vitamins? We're required to talk about iron foods during pregnancy.
Also just host like open workshops for campus throughout the semester so that anyone can come to when they're interested in learning more about healthy relationships and sexual health.
What resources are available, and is there programs already targeting food insecurity for a target population?
Athens-Clarke office. We are a supplemental food program for women, infants, and children.
My research program really is two-pronged. So I study the effects of different chronic health conditions on growth, notably bone growth, but also develop methodologies for clinical and research practice so we can assess and identify people at risk.
Whatever schools we apply for, we are able to get that grant. And that's a really interesting program that it exposes children to fresh fruits and vegetables that they may not have been exposed to at home.
The community assessment conducted for Athens, Georgia, located in Clarke County, provided evidence of how vulnerable low-income individuals are to food insecurity. Through primary and secondary data, the main public health concern for our target population is the inability to acquire adequate food because of insufficient income and other food resources. Athens, Georgia has the most food banks, the most fast food restaurants per square mile, the most convenience stores and supermarkets compared to other towns in Clarke County. Implementing the 7 key informants input, reviewing demographic data, budgeting for WIC/SNAP recipients, we have created a proposal called D.A.W.G.S, Start Where They Are, to help support and provide a tool for our target population. This tool will be utilized as a resource that brings awareness to food insecurity by influencing the behaviors and attitudes of our target population. Our program will hold space for understanding cultural diversity, all while meeting each individual where they are in their nutrition journey. Our proposal holds space for small, measurable changes, promotes self-efficacy, self-identity, provides personalized care, user-friendly, and accessible. 45% of young adults spend 6 to 8 hours a day checking their social media sites according to our resource. D.A.W.G.S, Start Where They Are, a proposal located on a social media platform, will provide optimal exposure to our target audience. Further, we will implement our website with a free complimentary mobile/audio app called Dietary and Wellness Group of Supplements, D.A.W.G.S, with a printable version to accommodate every individual's position. Our proposal is the ultimate tool to support food insecure individuals with resources on the qualification of governmental and federal assistance programs like WIC and SNAP and to use those resources and how. Implementing GPS, each individual can put in their address, which then locates resources in their area. Walking distance, nearest Athens transit bus routes, and contact information of directors of each program will also be provided on our website/app. This crucial part of our proposal should eliminate anxiety and confusion of where resource is provided and who qualified. Additionally, the website/app will utilize the abundance of fast food restaurants in Athens to educate each individual on choosing more nutritious options and how to use supplements from WIC, SNAP, Campus Kitchen, Food to Kids, and food pantries. Sample meals from various fast food menus will show a nutrient analysis and benefits of incorporating a serving of fruit, vegetables, whole grains, dairy, lean proteins to fast food items. Lastly, this user-friendly tool will provide tips on reading food labels and budgeting cost-effective, healthy, and satisfying balanced meals around culture, diversity, and identity. We aim this tool to meet individuals where they are in their nutrition journey and take away their stress of food insecurity. COVID-19 has impacted communication, involvement, and funding of many programs that are aimed to tackle food insecurity in Clarke County and Athens, Georgia. Our program will use the University of Georgia's grant funding, key informants volunteer capability, and surrounding towns that have available resource. D.A.W.G.S start where they are. Goals to decrease food insecurity. Our objective is to decrease 30% of Athens food insecurity rates by the end of the year. I got my peaches